Hello, this is Soheila Rostami. I'm an oculofacial plastic surgeon with 25 years of experience. So the reason I decided to do this for you is there are a lot of misunderstanding and misinformation out there that I thought maybe I can shed a light on some of your questions related to facial cosmetic surgery. So I decided we're going to do at least maybe 2 times a month, Mondays at 4:30, and we're going to do it on a routine basis. So then you can kind of get used to this kind of interaction with each other. So, and I will have guests possibly, but most of the time it would be me. And I will, at the end, with the things that we discuss, we would put articles, then you can verify the information that was given to you. Because I really want you to not to just take people's for what their word is, but actually learn how to verify what they say. So let's just start today talking about what has happened in the facial cosmetic surgery during my 25 years of practice in facial cosmetic surgery. The first thing I wanted to talk to you about is neuromodulators. Neuromodulators or neurotoxins are considered one of the number one changes in facial cosmetic surgery during the last quarter of century. The neuromodulators or neurotoxins, botulinum toxin A is in particular, is what has been used in cosmetic world for facial enhancement. It's a preventive sort of pathway to aging. So how did it came about? Neuromodulators, neurotoxin, botulinum toxin A, and also botulinum toxin B, all of these, and there are other categories, were used since 1970s for different medical purposes. One of the ophthalmologists noticed during the spastic or strabismus use of neuromodulators, it was for blepharospasm that we were using, and hemifacial spasm. For hemifacial spasm, when we were using the neuromodulators, we learned that the side that we were using the neuromodulator didn't age as the side that we were not using it. So then they were husband and a wife. The PhD pharmacist was the husband, the ophthalmologist was the wife, and they discovered this, and they tried to use the neuromodulator, and Botox was created for the cosmetic use. So the first application for cosmetic use was glabella, and so they started to use this area, and it was approved around early 2000. So I think it was March of 2000, if I'm not mistaken, but I could be wrong, but it was in 2000 which was approved for cosmetic use. But we were using it pre-2000 for a lot of medical purposes. And it's still to this day, there are so many new applications coming up for medical use of this particular medication, which is a neurotoxin or neuromodulator. So any place that we need to decrease the muscle activity, because what it does, it affects the neuromodulator, so neuromuscular junction. So when the nerve wants to give a message to a muscle to move, it releases a specific chemicals at the junction of a neuromuscular connection, and that is blocked by those neuromodulators, and so the message from the nerve does not get to the muscle, and that's how these products work. So we can use it in any musculature in the body to stop that contraction of the muscle. So that can be for cosmetic, can be for medical. We use it for so many facial spastic movements, along with inside the body. If you have any sphincter in the body that is spastic, the GI specialists use it. If you have vocal cord spasm, they use it for that. They use it for cerebral palsy patients that have a lot of spastic movement, and they stop those kind of contractions. So it has so many applications in medicine. A lot of you guys say that these are toxins. I do not want it in my body. Let me explain to you. We know this neurotoxin in so many ways that it's better than any other toxin that you use in your body. So we are taking advantage of the benefit of this toxin to use in different applications. So one of it is cosmetic. So we know how many units can be used in a specific ways to give us the results we're looking for. Now, so the person who is doing it needs to be very aware of the anatomy where they're injecting. So they need to know the muscles they're targeting. They need to understand what that muscle that they're paralyzing is going to give the result for that particular things they're looking for. So that's why they really need to be anatomists if they really want to be a good injector for the neuromodulators. Now, there are so many of the neuromodulators today since the 2000. Botox had the monopoly for 10 years, but that got over in 2010, and since then we had the Dysport, we have had Xeomin, we have had Juvo, and many others. So there are many different neuromodulator type A available for cosmetic use and also for medical use. Now, can you develop resistance? Yes, you can develop resistance to neuromodulator type A. Now, if you develop the resistance to neuromodulator type A, you can use neuromodulator type B or C. But those are really hard to come by, it's not easily available, and they don't last as long. Now, it also possibility that you could have zinc deficiency to cause you not to respond to neuromodulators as well as you used to be. So some people come and say that, oh, the neuromodulators used to last me at least 3-4 months. Now it's only 6 to 8 weeks. So that gives me incentive to try to see if with the zinc supplement I can make them to go back to their previous length of progression with the neurotoxin, or lasting as long. So because they're really still responding, but they're not responding as well. So for the neurotoxin to work at the receptors, they need zinc, and that's the reason zinc deficiency may cause the problem there. So that's also an important thing to consider when you're not responding as well to neuromodulators type A. Now, there are some people say that if I do neurotoxins, I may age more. That is not the case. As I mentioned, neuromodulators or neurotoxins type A's they were created to prevent aging, not to age you. They prevent aging. I'm a great example of using neuromodulators since I was 27 years old. And I can tell you, if you compare me with my mother had the eyebrow ptosis, has a lot of wrinkles around the upper third of her face, and I have been able to prevent that by just having the neuromodulators injected on a routine basis since I was 27. And I've been doing my own injection. A lot of people don't like and they frown upon self-injection, but I don't believe in anybody else that's know my body better than me, so I like to inject my own neuromodulators. They only last about 3 to 4 months. The Doxify that recently was approved promises to be a little bit longer acting. To me, I don't know. I haven't been proven to be that's the case. There are very few people that I have injected with Doxify that have had longer lasting period for their neurotoxin. I don't know. I mean, there should be some studies coming out soon to show actually they do last longer. But tell you the truth, it hasn't been proven to me. So I feel like when they launched Doxify, they charged much more for the product, and they really didn't take off because of the price differences, and the patients were not willing to go for it. So we had to pass on the cost to the consumer, and the consumers were not happy to do that. So I'm still on defense on this. So I don't know if Doxify lasts longer. It has not last longer for me as an individual user, but that's anecdotal. So when they say anecdotal evidence, means that one person saying, but when we're talking about studies, means that they've gone through a number of people, that the p-value is acceptable. There is a p-value that we care for, and it has to be large number of people that you can make a decision that this study is a correct study. So I mean, the studies that were done, they were done by the company, so I don't trust the company. I need to have independent studies to come out, and since they just got launched not long ago, I don't know if there are studies. I will look for them and I will put it up for you if you want. So that would be something that I would definitely look into for you guys. But you have to understand, the company's studies are not reliable. Yes, they say that this is what the paper showed, but I don't know. I have no idea. They have a gain to show that this is longer. I need to find somebody who doesn't have a gain in it to actually be unbiased and show the actual truth about the Doxify. So we're waiting for that. So now, this is the whole concept of neuromodulators. Is a preventive. We can use it in upper third of the face. We can use it in a nasal area to give, some people have a flare of the nostrils, so we can decrease that muscle movement that brings the nostril flare. Bunny lines, it doesn't work as well on the bunny lines. We can use it in the lower third of the face, so it can improve the chin, marionette lines, and necklines. So actually can be used, the whole face can be treated with neuromodulators. Now, I like you guys to put questions related to these neuromodulators. I pick topics and I will talk to you again in 2 weeks. So every 2 weeks I will have a topics and we can talk about them. And hopefully this will help you to be able to identify what make a good difference for you to consider for your cosmetic facial enhancement. Thank you for listening to me.